It's Sarah Palm. Say how Charlie Snipe was.
The wait for an organ when someone is in need can feel like a lifetime. We learned this week former Vice President Dick Cheney waited more than a year and a half for his heart.
He's recovering today, but his transplant is sparking new questions about the organ donation process and what's being done to help patients while they wait for a donor. Channel 3's Amanda Barron is here now. There's an amazing example of that going on right now at the Cleveland Clinic of all places.
Yeah, and a very cute little boy, too. I've introduced you guys to before back at Thanksgiving. Now I want to tell you more about Charlie and this device that he has. It's truly a lifeline for children. You've heard of heart machines and lung machines used during surgery for a short period of time and with all kinds of medical folks around. But this device is really different because it really becomes a part of the patient, their family, and their lifestyle, at least while they wait for the heart they so desperately need. This week will mark 6 months since Charlie McMicken has had to call the Cleveland Clinic home. Born with cardiomyopathy, he's still waiting for a heart transplant.
Every day I'm touched, there's something new. Somebody else has reached out to us.
And while the heartbeat of their caring community is present all over Charlie's room, his heartbeat is amazingly visible too.
He's as stable now, I think, as he may have ever been.
It's all thanks to the Berlin Heart. The device can assist or take over for a failing heart. The pumps are on the outside of a child's body and then connected to the heart's chambers. It bridges the gap between declining heart health and the wait for an organ donor.
Many kids would not survive with standard therapies or even what we previously had been using to sort of support people at the end stages.
The Berlin Heart has received only compassion use approval from the FDA, meaning it can be used only in serious situations.
Just to see his weight come back and his strength come back has been wonderful.
It's a big machine, now a part of this 3-year-old's every waking moment. It does come with risk, but the McMicken family will tell you the reward is great because it means something as simple as walk outside.
Second, we're unplugged. We have 30 minutes to walk around.
Good for this Spider-Man fanatic's mental health.
His cardiologist, Dr. Will, refers to him as Iron Man.
So as he waits, Charlie's family is gaining strength from their very own real-life superhero.
And he's a walking miracle. He's such a strong little guy.
And he loves some Spider-Man. The Cleveland Clinic now has these so they can help patients who reach a critical point like Charlie, health declining, that time is of the essence. Some of the risks include infection, blood clotting, and the fact that it's just invasive on such a small body. It's not how long a child can be on the device. In some cases, it's been 9 months. Dr. Stewart said in one case it was 2 years. In the meantime, the FDA is still keeping a close eye on the device to see if it can potentially be approved. But in the meantime, the Bainbridge Township and Auburn Township communities are wearing these bracelets and they say a heart for Charlie. Oh. And you really see them everywhere you go at the grocery store. So it's neat to see that there is truly a heart beating out there for Charlie everywhere.
You have to tell Chris what he does, because he's such a Spider-Man fan.
Oh, he's such a Spider-Man fan, so everywhere he goes, he walks around, he shoots webs at it. So it's
and he got your camera the other day.
He got my camera, and the camera was stuck in his webs, yes.
So cute. Amanda, thank you.
You're welcome.